My name is Sister Bettina, your trusted Right to Care personnel. Throughout the years, Right to Care has been dedicated to treating health seriously. Today, we'll be discussing the importance of being able to identify and prevent cervical cancer because all women are at risk, regardless of age. A lot of women are not aware of what the cervix is and how important it is to have a healthy cervix. The cervix is the lower part of the uterus, or better yet known as the womb. To put it simply, the cervix, or the mouth of the womb, is what opens when a woman gives birth to a baby. As we all know, prevention is better than cure, and therefore it is important to know what cervical cancer is. Cervical cancer develops when normal cells in the cervix change into cancer cells. This happens as a result of infection with the human papillomavirus. Change normally takes several years to happen, but it can also happen in a short period of time if you are HIV positive. As a woman, it is important to know all the risk factors for HPV infection, and these are having unprotected sexual intercourse, having your first sexual experience at an early age, having multiple sexual partners, having a sexually transmitted infection, most importantly HIV, and smoking. HPV infection can be prevented by a vaccine injection and by condom use. Meet Tepiso, a varsity student who is enthusiastic about life. She has developed increased vaginal discharge and is worried she might have an STI. She decides to go online and finds a Right to Care clinic where she goes for further consultation. Meet Mrs. Mkhize, an older woman in her mid-50s who loves spending time with her grandchildren and watching them grow. She has recently gone through the change of life, menopause. She has had a few episodes of bleeding, and she knows that this is not normal after menopause. She speaks to a friend who recommends a Right to Care clinic. Meet Candace, a young woman who is happily married and runs a successful business with her husband. She recently turned 30 and decided to find out what a woman her age should be doing to stay healthy.
Hi, how are you? I'm great. Your name is?
My name is Tepiso. I have a problem I'd like to discuss with the nurse, please.
Hello, and thank you for taking time and putting your health first. You know, a lot of people don't know the signs and symptoms when it comes to cervical cancer. Symptoms usually do not appear at an early stage, which is why it is so important for you to have regular screenings. But at a later stage, the symptoms include lower abdominal pains or back pain, bleeding after menopause or irregular bleeding, bleeding after sexual intercourse or douching, and increased vaginal discharge. Even if you don't experience these symptoms, you should consult a health professional at your local clinic. If you don't experience any of these symptoms, we encourage you to see a health professional, and we encourage you to have more screenings done, for example, a Pap Smear.
So, is there anything I need to do before I get a Pap Smear?
Yes. In order for you to plan for your date, we encourage you to plan on a day when you are not having a menstrual period.
Okay, so I've never gone for a Pap Smear before. Can you please tell me how it's done, because I heard it's quite painful?
We gently insert a speculum, which helps us see the cervix better. We gently take a sample of cells from the outside and the canal of the cervix by gently scraping the outside and the canal with a wooden or plastic spatula. Then we place a brush inside the canal that looks like a pipe cleaner. The cells are then placed on a glass slide or put into a bottle and then sent to a laboratory for testing. While the testing is being done, there may be a slight discomfort similar to menstrual cramps and the feeling of pressure. But this is all worthwhile as your health comes first.
Sister Bettina, when will I get my results and what do they mean?
Okay, the results come after 4 to 6 weeks. They are classified into 3 categories. The first one being negative. This means that everything is okay and normal, but you should still continue screening as per recommendations. Lower grade changes. This means that you should repeat the Pap Smear after 1 year, as there are some abnormalities, but rest assured that this does not mean you have cancer. High-grade changes, this means you need to be referred to a doctor for more testing because of the abnormalities seen on your Pap smear, and you may need treatment. Keep having Pap smears throughout your life, even after you have gone through menopause. Cervical cancer is the most easily detected and, if caught early, the most cured of all the cancers of the female reproductive system. Speak to your doctor or your local clinic for information regarding the HPV vaccine. So put your health first always, and remember to always make time to visit your local Right to Care Center.